Moving on, while we're talking about July 4th, getting answers to questions about COVID-19 cases, vaccines, and much more, we're now up over 60% of Connecticut fully vaccinated. That's the entire population. And because of that, this year's July 4th celebrations may start to look a lot more like previous years.
I was going to say a lot different than last year for sure. COVID-19 is still present in our community. Dr. Hussain from Trinity Health of New England joining us now once again. Doctor, thank you so much for joining us this morning.
Morning. Thank you for having me.
Well, let's start off. It is a holiday weekend. Naturally, folks are going to want to get together. What are some steps that folks can take to stay healthy this weekend? Obviously, since you're not necessarily aware of who in the home may be vaccinated or unvaccinated.
Sure. So let's talk about those that are not vaccinated or partially vaccinated. For those individuals, nothing has changed. So I want to underline how important that is for them to realize that they need to stick to public health measures that includes masking, distancing, avoiding practicing hand hygiene, avoiding large crowds. Even if they're in an outdoor setting and it's a group of individuals that are not living in the same household, they need to be masked up. They are at very high risk because we have a very contagious variant that's doing the rounds in this country now and spreading. If you are fully vaccinated, it is safe to remove your mask. And as per CDC guidance, which was last revised in May, we await additional guidance. But it's always a good idea to assess your risk. If you're an individual with underlying medical problems, if you're taking immunosuppressive medications, any of those, then you are at higher risk. So it's when in doubt, wear a mask, especially if in an indoor crowded situation.
Let's talk about that Delta variant for a second. Obviously, it's much more transmissible than the original strain and the other strains like the Alpha one. But what do we know about whether or not it is more virulent and what symptoms and the symptom profile is like compared to other variants in the original?
Sure. So based on reports we've received, the medical community is crunching in from India and other countries. It does appear to be more virulent, which means tendency to cause more severe disease. So that's why it's really, really important that you practice public health measures if you have not been vaccinated. Symptoms, though, tend to be the same that we've seen with this virus since this pandemic started. We haven't seen any new additional symptoms with this virus, with this variant, but we do know that it does cause more severe disease.
All right, and obviously this year more people are going to be wanting to get out and get together since things were shut down last year. Do you think that this could potentially lead to spikes that we saw after holidays last year, Thanksgiving, and in the winter especially, we saw kind of an uptick in the percentages. Do you think this might be a similar situation?
So we will likely see a tale of two Americas here. Those states in this country that have really lagged behind in vaccination, and we already see Missouri, for instance, a really big spike in cases, and those that would be relatively okay, such as our state and our region, which has done a phenomenal job in getting more and more people vaccinated. So I don't anticipate that we will see high case numbers in Connecticut or this region, but other states, we already have started seeing the cases go up.
And I also wanted to ask you, just looking at the numbers now about how it's transmitting here in Connecticut, we're doing very good, obviously, but it looks like our drop has hit a low point in terms of hospitalizations at around 30. The 2-week rolling average is looks like it hit its low point maybe 7 days ago, still under 0.5%, but maybe just starting to tick up a little bit. So if we have hit our low point, do you think this is a good enough low point? Of course, we want to be at 0, but are you pleased with the progress we've made, or did we need to keep getting further down to be more protected?
Very pleased with the progress we've made, but we still have some ways to go in terms of those individuals in our state, in our region. We have now 70% or higher that have at least received one shot. So we need the other 30% or so individuals to also roll up their sleeves and get vaccinated so we can protect the entire community.
Okay. Dr. Syed Hussain from Trinity Health New England, thank you once again for joining us, as you have so graciously done every Friday morning.
Thank you.